All right, in this segment, I'm going to talk about wound dressings. As a medication aid, you are capable of doing wound dressings. You are not capable to stage a wound. You can describe it. You can describe what you saw. You can describe the area of redness. It's got 2 centimeters of redness around the wound or whatever. You can do that, but you are not allowed to stage it. That is something that an RN has to do. So I really highly encourage you, if you are going to do a dressing change, that you coordinate with your RN and you say, hey, I'm going into Ethel's room and I'm going to change her dressing. Would you like to come in and see what the wound looks like? It just works better because it coordinates the 2 things. And she's not going into that room 2 hours later and undoing your dressing that you just did to look at it, okay? Because she has to document. She's got to be the one that stages it and documents it. If there's measurements that are required, she does all of that. So I'm going to bring in our prosthetic arm here to show you about wound dressings. So when you get ready to do a wound dressing, of course you're going to need your resident, but you want to gather your supplies. So when you gather your supplies, you're going to want gloves, you're going to want some sort of a dressing. I've got some gauze, I've got Coband, I have a little bowl because I'm going to do a wet dressing. We're going to talk about that. I've got the gauzes for my dressings. I've got my wound cleaner and my medications. So I've got everything assembled, and then I'm going to put on my gloves to do the procedure, okay? I don't want to put my gloves on first and then get everything together, because then I just have to take those gloves off and start again. So we're going to start out first with a wet dressing. So I'm going to go ahead and I'm going to put on my gloves, and I'll explain to you about wet dressing as we go along here. So a wet dressing is exactly that. It is a dressing that is wet somehow, whether by medication or lotion. We'll go over a couple of those kinds of things here, okay? So when you're going to do a dressing change, we're going to act like the wound is right here on the top of the arm. It could just be a really bad rash, like an eczema or something that's open and weeping. So we're going to clean it with whatever the physician has ordered us to clean it with. In this particular case, we just have a Micro Cleanse wound cleaner. So we're going to spritz that on there. We're going to clean it. If the doctor says clean it with soap and water, that's what you're going to clean it with. You're going to do it as he has instructed, okay? So you get that wound all clean. And then you're going to go ahead and apply your wet dressings, okay? So like I said, there's 2 kinds of wet dressings. There's probably more than that. There's lots of kinds of wet dressings you can do. The first one I'm going to demonstrate is with a cream. Yes, you can do a wet dressing with a cream. So you're going to put that cream on your gauze, and you're going to rub it in, okay? And work it around, and so it kind of pushes into those pores of that material, okay? Then you're going to apply it to the wound in the way that the doctor said, you know, whether he wants it completely covered or only a certain section covered, okay? So this is one type of wet dressing, and then you're going to want to cover it. So you can cover it with Kerlix, which is kind of just a gauzy material. You can use Coband. I'm going to use the Kerlix, and then you're going to just wrap that around, okay, and then tape it down. So that is, this is one form of wet dressing, okay? So, and now I'm going to show you another type of wet dressing. Again, we're going to clean off the area as instructed by the doctor. And then for this wet dressing, the gauze that I used, this gauze was sterile gauze when it was in the pack because it was taped shut. And so it was sterile at that point, but once the bag becomes opened, it's no longer sterile. It's clean, but it's not sterile. So We've got the gauze that we're gonna use. You need some kind of a bowl or a little cup or something because you may have a liquid medication that you need to pour onto your dressing, making it a wet dressing. So you want to squeeze this gauze out. You want to make sure that it's not drippy, but you definitely want it soaked, okay? So you want to kind of make sure that you squeeze it out enough that it's not drippy, okay? And then you could put this on. Now for this dressing, I'm going to use something as simple as, nope, I'll take that back. We're going to go ahead and use the gauze, all right? So once we've got this wet dressing on here, then we're going to go ahead again with the Kerlix and we're going to wrap it with the Kerlix around a couple of times, whatever it takes. And then again, you can cut the Kerlix and tape it into position. So you've got the Kerlix that is also holding that wet dressing on. Now, wet dressing isn't something you're going to use all day. It's okay, it's wet. You don't want that skin to stay wet and bulky for a long time. This is a dressing that the doctor may prescribe for an hour or 2 hours, but you need to be coming back and take it off at the time that he prescribed, okay? So your wet dressing is not something that is going to be like a 24-hour dressing. It's going to be a short-term dressing. Again, take off your wrap, throw it away, throw your gauze away, and you need your cleaning products that you used. So those are the 2 kinds of wet dressings. I mean, like I said, there are quite a few others that you can do, but you need to make sure you clean the wound the way the doctor's recommended, and you apply the medications that he's requested. So the next kind of dressing that I'm going to do for you is an occlusive dressing. And the occlusive dressing is, it's just that, it's occluded. There's no air in, no air out. There's no drainage in, no drainage out. Water can't seep into it. That's why it's considered occlusive. Okay? So, again, I've got my wound here. I've cleaned it. I'm going to put an ointment here on the wound that the doctor has prescribed. Okay? So I'm going to put this on. And again, if he says put on a thick layer, you're going to put on a thick layer. If they say, you know, to work it in well, then that's what you're going to do. So we've got our wound here. But for this occlusive dressing, this one I'm just going to use something as simple as saran wrap. Okay? So you get your saran wrap out. And if you think about it, saran wrap, you apply it to this dressing, you wrap it around, and when you tap on it like this, of course, it makes it occlusive. So why this kind of dressing? What this does is that keeps that medication from being rubbed off on their clothes or on the sheets or on the dining room table or wherever. So they're able to absorb more of the medication because it doesn't rub off. So this is one form of occlusive dressing. And then the last one that I wanted to cover with you for an occlusive dressing, it talks about a more of a sterile occlusive dressing. There again, this is something you may or may not be doing. I'm going to go through it because you can do it, but I want to show you how to go about it. Again, you're going to clean that area, and then you're going to have something that looks like this. This is, this one says it's a Medline SureSight. They're Tegaderms. There's all kinds of names for them, Opsite. But it is a clear dressing, but it's sterile. The inside of it, you don't want to put your fingers all over it. It's sterile. You want to keep it as clean as possible. So you've cleaned your area. So when you open this up, it gives you this little window. but the outside edges are not sticky, okay, so that I can hold on to them and I'm not doing any damage to the sterile surface of it, okay? So I'm going to go ahead and put on my occlusive dressing, sterile occlusive dressing, okay, and I'm going to take it down on both sides. Now this particular one is really nice because it has this paper outside, so you can take it around and just take the paper off. That's the last thing you're going to do, is to take that paper edge off, okay? So you're going to go around the whole wound and take that off. Now this particular dressing is really, really nice because it gives you this little paper tab here, and it says your initials, the date, and it says gauge, but that's for an IV needle. But any dressing that you do, you need to time it and date it, and it's always best if you put your initials on it. So I recommend you do this before you stick it on the person. I mean, you can always write on them when you're done, but it's much easier to write your information on this little strip, and then it goes right on to that occlusive dressing. So again, this dressing is occlusive. There's no air in, no air out. There should be no way that any kind of drainage can leak out or anything. So this is going to protect that arm really well from any kind of shower, rubbing, anything like that. And again, these dressings are changed as the doctor is ordered. So I want you to make sure that you remember with the occlusive dressings that you're applying the one that the doctor requires. Now, the reason I'm talking to you about wounds or dressing changes is because, again, as a medication aid, you can do them. It is part of your training. So we talked about wet dressings and occlusive dressings. And why is that important to know? Because wet dressings and occlusive dressings, both of them will increase the absorption of the medication. Okay, both of them help that medication, whether it's under a totally occlusive one like this, that medication's not going to rub off on me, nothing's going to get into that site. So that's what I want to make sure that you understand, because on your state and final, it talks about wet dressings and it talks about occlusive dressings. And the purpose for them is to encourage that absorption of medication, okay? So that's what we're looking for. We want to increase that medication's ability to absorb into the skin, and whether that's by a wet method or whether that's by occluding it and keeping out everything else, those are the two different kinds that you are able to do.